Victoria has dumped plans to establish a second safe injecting room. People who live in North Richmond, near the state's sole injecting room, have now vented their frustration at the decision. And joining us live now, North Richmond resident Maynard. Christine, good to have you with us this morning. Thanks for your time. So let's just start off with your reaction to this backflip.
Morning, Peter. Thank you for having me on. I'm not surprised. I'm actually disappointed. I was just hoping that they would open one so that people would experience what we've had to go through for almost 6 years here in Richmond. What's most alarming is we've now got the whole of Victoria coming to one area, and it just exposes this government more than I've ever seen before.
Just elaborate then, for those viewers who might just be catching up with their story who don't live in Victoria, what are some of the things that the residents have to deal with?
So we've got open injecting, we've got dead bodies, we've got overdoses, we've got drug paraphernalia everywhere. It's just an indictment on this government that they continue to expose not only our children but the vulnerable community that live in the public housing. There's 5,000 residents that live right on the doorstep of this so-called medically supervised injecting room. What we were told before they implemented the injecting room is it would improve our amenity. In actual fact, there's 18,000 needles being picked up a month in our community.
Yeah, and you got kids all around that.
Yes, well, it's 30 metres from a primary school, and anybody who thinks that's acceptable, is beyond belief. Our children should not be exposed to this kind of situation. What we're asking for is it's moved. We understand that the drug users have issues and trauma in their life, and that's not to be, taken lightly. Except, our community deserves better. We're asking it to be moved to a better location, which would be next to a hospital, where our emergency services, including the ambulance, who now have writing all over their ambulances telling us how hard they're working, and they're going to this facility daily, if not multiple times a day.
Yeah, and this is precisely the reason why there wouldn't be a second one in the CBD, because traders and people who are close to the CBD don't want that either.
No, correct. Well, why should we have to? We never got any consultation in relation to where they dumped it right on our doorstep. So why have they got so much consultation? And why have the government decided that, oh no, this location isn't correct? No, that location isn't correct. But a location right next to a primary school, next to our community health centre, is correct. So none of us use the community health centre because all the drug users and the drug dealers are right outside the door, and you have to walk past them to enter. So why is it any different for them?
What do you make of this $95 million addiction plan that features an advisor, hotlines, etc.?
It only, is alarming. We paid $275,000 of taxpayers' money to have a report done. I mean, you could have come to me for 25 cents and I would have given you the same information. It's not anything that we didn't already know. It's not anything that we haven't already told the government over and over and over again, but they continue to waste taxpayers' money on something that's not going to work. And if these people in the city think this isn't going to affect them, they've got another thing coming, because, some things were said yesterday. I'm going to start calling it the underground injecting room, because that's exactly what this place is going to be.
What sort of problems do you think the city is going to get?
Oh, well, there's already problems 100 metres down the road on the corner of Flinders and Elizabeth Street. So if they don't think this is going to migrate 100 metres up the road, I don't know what these people think, but these people should be fighting for their businesses, because I can tell you now, if you walk down Victoria Street, those people have all lost their businesses. It's like looking at a ghetto. But this government refuses to listen to the people who live through this, and then they go and put an underground injecting room on these people's door. So, hydromorphone needs to be medically supervised. It's generally injected into someone's arm, which involves a needle. Are they giving out needles? But we were also told by Dan Andrews that he would never put an injecting room in Victoria, and look what we have on our doorstep. Secondly of that, he then turned around and said that he'd never allow ice in there. And we see ice addicts like zombies all the time in our community. So which one is it? Are we going to have an injecting room there? Are we going to play around because we smell an election and then introduce drugs into this? If anyone thinks this is implemented the way it should be, needs to have a reality check.
Okay. Christine, appreciate your time. Thank you. We'll talk to you again soon.